Yeah, thanks to everyone that's joining. This month's webinar is a bit off of our normal script. Usually we talk about feature announcements, platform-specific best practices. But today we're excited to announce a partnership that highly benefits our coaches. So this partnership will give our coaches that are inside of CoachRx a massive leg up on most coaches in the space, and a partnership that adds that, let's call it like that public validity to what you guys do as fitness coaches. So this partnership is with TrueMed, and we have its co-founder, Callie Means, on today to lead the presentation. So I'm just going to kick this off, and I'll kick it over to Callie in a second to intro himself. But before I do, I just had two things that I wanted to hit. So number one, Callie, I just checked out your pharma food government, follow the money on PragerU. Very, very well done. So I just want to give you a shout out and some praise for that. That was great to see / listen to. Fighting the good fight, man. And number two, and not to steal your thunder here, Callie, but on Callie's first slide, he says exercise is medicine. I want to double down on that and say that exercise actually transcends medicine. There's no medicine in the world that can have the impact that exercise, namely, but also nutrition and lifestyle interventions, can provide. And you guys are doing that. Okay. You guys are on the boots on the ground doing this stuff and executing against this. So today the conversation is around transforming preventative healthcare. So we're calling exercise healthcare today. Okay. So Callie's really going to dig into the weeds there. So I will kick it over to Callie.
Thank you, Carl. I'm so fired up to be chatting with you guys. And Carl, are you going to be doing the slides, or should I share my screen?
So Georgia's going to handle the slides. So
Great.
just get for a next slide.
Awesome. Well, let's go to the next one. And Carl, you explained it better than I could, but this is what we're really passionate about. And I couldn't say it better than Carl, but just want to unpack this a little bit. And if you go to the next slide, this is not just a buzzword. Exercise, literally is medicine. If you go to the next one, we all know this, but there are studies, thousands of studies, for any condition you could possibly think of, that explain how exercise is better than the leading pharmaceutical treatment. And we just sent the video, but we are on a mission at this company to establish root cause modalities, particularly these simple things like exercise, food, supplements, good metabolic habits like sleep. If we could get Americans and incentivize these things, we'd be a much healthier country. And, one thing that stands out to me on these studies that surprised me, even depression, they did a study recently where 150 minutes of exercise for 3 months was actually more effective than the leading SSRI in reducing depression. Obviously, diabetes and heart disease, if we were on a better exercise and food program, those are the two of the scourges of America right now, would be gone. But even now, dementia is called type 3 diabetes and highly tied to metabolic health. If you're exercising and you're eating well, actually, you dramatically reduce your chances of dementia. So what our company is doing, and if we can skip one more, is we found that this isn't just a buzzword. Actually, the definition of medicine from the IRS and the FDA, and we are a little, as Carl alluded to, a little bit cynical of the incentives of medicine and pharma, and do think a lot of these things are rigged, but they can't define medicine as just a pill, right? Medicine is what a doctor says can prevent or alleviate a physical or mental defect. And a key thing here is prevention. So medicine counts as preventative. So 60% of the country, probably some of your guys and gals clients, are actively trying to reverse a condition, but also prevention. And just a statistic and a fact that resonates with me is the American Heart Association, who's really pushing drugs usually, has actually said that the metabolic health crisis is so pronounced in the United States that every adult should be on a statin. Every adult. And we agree with the first part. There's a metabolic crisis right now, and every American adult should be on an urgent prevention plan. But we think we stand on great medical ground by saying that should be exercise. So this gets into FSA, HSA accounts. So FSA, HSA, if we could go to the next slide, HSA, FSA accounts are as some of you might know, you can spend on qualified medical expenses. And we'd estimate that about 45% of your clients have a funded HSA, FSA account. So about 80% of workers have access to one of these. The majority of Americans have a funded account. So these are pretty widely used vehicles, $140 billion in them. I personally have never utilized it before starting this company too much because it is kind of this thing. It's like, oh, are these, it's used to lose it for when you get sick. But according to the IRS, foods, supplements, and yes, exercise can be approved and this funds can be used if there's a doctor's note. And that's the key. And that's where we come in. If there is a doctor's note explaining how something like exercise can reverse or prevent a condition. And that's where we come in. We've worked with a lot of compliance experts, a lot of medical experts, and our question is, how can we make this as seamless as possible to give this letter to folks in a compliant way that unlocks that spending on exercise, specifically in this case. So let's go to the next one. And this is kind of the big idea. This is what we're trying to do. And let's just go quickly. I'll just review because some folks might not be, and it's been a learning curve for all of us on HSA, FSA. So I'm just going to highlight a couple additional points on the FSA, HSA program. So if we go to the next one. Yeah. So we talked about this. We connect, and I'm going to go really deep into our implementation process, but this is what we're trying to solve. If your client has a doctor's note tying exercise to prevention or reversal of a condition, then they're able to use these tax-free accounts. Next slide. That equates to an average of 30 to 45%. So the FSA, HSA accounts, just to be clear, if you elect for them, so we all do the open enrollment thing where we choose our yearly health care. 80% of working Americans have the option of contributing to their HSA, FSA accounts. And if, say, you can do up to $10,000 for a family, say you do $5,000, that automatically pulls out of the account of your paycheck over the coming year, tax-free, so pre-income tax. So this, is 30, 40, up to 50%, depending on the income level. And that's free money that's sitting in their account. So when you say to a client, FSA, HSA eligible, it'll ring very true. Again, we estimate for about 40%, 45% who just know implicitly then that's free tax-free money that's sitting in their account that they're usually just saving up to buy, scramble if it expires at the end of the year to buy contact solution or something. So that's a really good value proposition. And just saying the words FSA, HSA represents, and people understand what that means. It's tax-free money. It's a 30, 45% savings, 30% on average on that money. Next slide, please. And just to reiterate some stats here, as I said, about 80% of working Americans qualify, $135 billion in these accounts. So again, this was surprising to me, but this is a lot of money sitting there. And actually, we've been engaging with a lot of members of Congress. There's actually a lot of support for these programs. This was actually increased to $10,000 next year. So the contribution limits are going up a lot. And this is a program that has a lot of momentum behind it. If we go to the next one, another just element of HSA, FSA accounts is that large companies, particularly large tech companies, a lot of the big employers, their standard plan actually contributes money into an HSA. So for Google, for example, they contribute $3,000 per year into the HSA of free money. And starting this company, we talked to a bunch of friends at Google, and to the person, they open their account, they've got $10,000, $5,000, $50,000. They've got actually like a ton of money just sitting there. And 92% of all HSA money is just sitting in the accounts in cash. So this is underutilized money, that we're unlocking, right? That's often just sitting in the accounts there. So let's go, you can skip this next one. I think we can just move on. Carl alluded to this a little bit, but we really are on the warpath here, on a mission. So my background early on used to be in politics and been in startups the past decade. But we've really, just to give you guys hopefully some security on the compliance angle, and we'd like to think we're really a partner to evangelize a new world for healthcare. But we've talked to folks from the left and the right. Dan Crenshaw, who oversees the a committee that oversees HSA FSA. We met with Cory Booker on the left, who's very supportive of this. We've actually met with the White House and two of our earliest investors, Mark Hyman, who's had a big impact on us and has said, has given a lot of talks about how if medicine was a pill, it'd be the best selling drug ever. He's chair of the White House conference along with former Senator Bill Frist. So we've been really working and have gotten support bipartisan on this interpretation, and like to think we're part of the bleeding edge here with our amazing partners, like you, who are slanting healthcare spending, not to sick care, but to healthcare. And the next slide, we've been on it, really trying to promote this mission and promote this long-term mission of our goal is to just give more and more money to personal trainers to exercise. It is the best public policy we could possibly do, and we're trying to use the momentum of our company to really make the argument publicly and to members of Congress that more healthcare dollars, we spend $4 trillion on healthcare. Our goal with this company over the next 20 years is that $4 trillion more and more goes through various programs to paying for exercise. Joe Rogan's already talked about us. We've been really trying, that's our goal. That's our mission. So let's just dive real quick into the implementation here, and then I'm happy to answer questions. So our goal is to, let's get down to the brass tacks of the business here. Our goal is to drive you incremental customers and increase retention. So let's just go into the next slide here. She should have a link. You can create a merchant account, and it takes, a couple of minutes. You put in some information, put in your credit card, and then you'll get a link, a custom link from us. And it's your choice. And we're here to, I think our contact should be on there, but we're here to strategize on marketing best practices. But you can merchandise that link however you see fit. And here's how it's worked for Coach. Here's our best practices. For incremental customers, if you're talking to a client and inevitably they might have some price sensitivity, you can ask them whether they have an HSA FSA and then offer them that link. So it's part of the sales process. So with high touch sales processes, when you're talking and trying to bring a client on, this has worked really well when there's a price flag. So it's a nice thing to offer. Hey, by the way, most folks are eligible for HSA FSA if you're working to prevent or reverse a condition, like most Americans are. Here's a link, and you can then submit your expenses for HSA FSA reimbursement. This also works very well for existing customers, who are on the monthly plan or anything like that, or customers that have even churned and stopped paying. It's something that you can offer. A lot of our customers who are really trying to beef up retention, have offered the link to all of their subscribers, and that's actually worked very well. So what you're really doing for a current subscriber is giving them a pot of free money to use, and that's going to be just for future subscriptions, future payments. So it's kind of a win-win, and it's giving them that incentive to basically a 30 to 40% savings on future payments. And then just to be clear, when they take that link, that survey, and we send them the letter of medical necessity, it's a very straightforward process for the customer. We enable them to reimburse your expenses just the exact same way they'd reimburse a doctor's appointment or anything else on the $140 billion that are spent on HSAs. It's actually a very clear process. We're here to help with any customer support or issues, but there's actually been, for me, surprisingly little support questions on the actual process. We provide the note, and then they're able to reimburse you guys like anything else. So great question. This does not change. We have a couple models, and we do have a payment integration. This model for you does not change how they pay. This is simply a link that then enables them to submit their current payments that they're making on their credit card for reimbursement. So you do not have to ask them to do anything different with payment. That's just the normal flow. This is just a separate link to send them that enables them to reimburse those payments. Let me, if it's cool, I can land the plane here, and then Carl, does that work? And then I could go through some of these questions.
Yeah, definitely. Let's
Awesome.
yeah, let's get through it and then we'll
Cool. Cool.
20 minutes.
Yeah, let's just let me just, this should be pretty quick, but if we could just go plow through these rests, and we've covered some of this, but if we could get to the, yeah, I mean, this is, again, there's compliance work here, and that we're working with telehealth experts. The former outside counsel for some of the big telehealth companies is working with us, and that's just our value add. We handle a lot of the basically seamlessly handle the telehealth to where for you as coaches, it's as simple as giving folks that link. And then for customers, it's as simple as a 3 to 4 minute telehealth survey. And then we'll asynchronously review that and send the note. If we could go to the next one. This is just interesting. Like there's a practice of medicine laws where technically a company or a coach wouldn't be able to like employ somebody to prescribe their own product, but we handle all the compliance basically is what you need to know here. Let's go to the next one, please. Yeah, and then just a little bit. We're as you can hopefully see in this for the long haul. We've got a great team. My co-founder and I are experienced founders, and just trying to build something lasting here, and really feel very proud and energized to evangelize folks like you who are working to actually promote health. So I'll stop there, and Carl, whatever you think, I'm happy to just go through the questions in the chat, or however you want to do it.
Yeah, let's hit a quick closing, Georgia. So if we can go to our closing slide, I'll hit this. So guys, I just dropped the link for, it looks like most people on this call are current CoachRx users. So we went ahead and added this step-by-step instructions, namely with, what we would expect you guys to walk through as coaches in the integrations section of CoachRx. So I just dropped that link in. If you're not already in CoachRx, please check us out. Follow the link. Georgia just dropped it in the chat box there. Start a 14-day trial. Just head to coachrx.app. If you're coming from another platform, we do offer free transition assistance to get you onboarded and smoothly transitioned if you're coming with 50 plus clients. So as you get in, you start that 14-day trial, you check out TrueMed and what they have going on, and you decide to bring over your client load, we do have an option to seamlessly transition if you're coming with 50 plus. So let's kick it over.
And I forgot the most important part, Carl.
Yeah.
Coach, we are so excited about this partnership, and we are offering the lowest price we've offered on this, a 50% savings to CoachRx clients. It's only $30 for this telehealth work, which unlocks a year's worth of savings for the customer. And we're seeing driving significant, both driving incremental customers by enabling that savings, and retention by enabling that 30% savings to the customer future. So it's more than 50% off than what we've offered anyone else, is the lowest price we're going to offer. And obviously just the highest level customer support we can offer. We're very excited to partner with CoachRx and enable everyone listening to hopefully drive more business.
Awesome. Yeah, man. But yeah, we really appreciate this. So we had some really good conversations going coming into this partnership, and it was just an absolute no-brainer for us. We talked about bringing value to the fitness coach over and over. And our very first conversation, I was like, yes, how do we get this thing rolling? And just to be clear on that pricing, because I had that same question as well, Josh, is it like $30 per month? No, it's $30 per year per client. That's it. Okay. So it's not $30.
Yeah, this is just a flat fee. That if one of your clients takes that survey, and this is active customers, if it gets the wrong, somebody accidentally takes it, we won't be charged. This is for a customer, a paying customer. If they take that, that pays for our telehealth work and customer support to get your customer that note. And that note then is valid for a year. So the $30 will be charged to the coach. But that will enable your customer, that will unlock that. And in your conversations with that customer, right, you can then let them know that they are going to be able to tap into those tax-free funds to pay for your services for the next year.
Awesome. Yeah, let's dive into questions. So Lee, I think Callie answered that question. If you have to bill through CoachRx, no, that's an initial conversation that we did have. We were going to do an integration with our billing, and we just wanted to eliminate barriers for coaches to be able to use this. So if you're billing through CoachRx or not, it doesn't matter. You can still use TrueMed. Callie, I'll pass this one over to you.
Great.
I know the answer to this, but does this work also in Europe, Germany, or is it only US based?
This right now is US based. This is an idiosyncrasy of the US healthcare system. We are absolutely like evangelizing, and our goal is to spur healthcare dollars to fitness, and we'll absolutely be reviewing, Europe, but we are unlocking the HSA FSA spend, which is an idiosyncratic to the US system right now.
Awesome. Thanks, Callie. Next question. Do they have to be a TrueMed client to benefit from this, or can they still use their PCP?
Yeah, that's a great question. So yeah, like we got this idea from Dr. Mark Hyman, functional medicine godfather, who in his functional medicine clinics sometimes wrote letters of medical necessity for food or exercise. We have dived into that. So the answer is if somebody's PCP writes specifically a note for exercise, that would count as well. We have two interesting kind of ways we see that. One is 90% of doctors graduate medical school without one nutrition class or really any class on functional issues or exercise. It's very little part of the curriculum. And in some of the large health practices, we've actually dug into this, like One Medical. If the doctor goes outside of, like, they type in the, symptoms and get the suggestion, and they're often not even able to go outside of that. So there's a lot of friction to getting that note, and a lot of health practices, I don't even think you can get the doctor to do that. But yeah, we are making that process very, very seamless. We have a little bit of cynicism about the ability or aptitude of many medical practices to create a root cause plan and note. But yeah, if somebody has a functional medicine doctor that writes the note, that would count as well. We're making that super seamless.
Yeah. So just for some additional context there, if you guys have been around for a while, we've been trying to solve this for, almost a decade. Like, how do we tap into this? And we've seen one-off situations where, we've had coaches that have had the right doctors, and they've made this work. What TrueMed is doing is they're scaling this, right? It's like, no matter who you are, who your primary care provider is, you can still go through TrueMed. So that was the biggest issue that we saw. It was just, there's a huge barrier and a lot of tension from a primary care provider standpoint. So that's where I think this solution is just outstanding. Next question, Callie, can you clarify how the client saves 30 to 40%? Does that mean 30-40% of expected monthly coaching fee gets reimbursed? Sorry, I'm gonna read all these questions because most people actually review this webinar via the recording, and they're not here live. So I'm gonna be redundant there.
Sure. Yeah, great question. So let me just go tactically, and I just want to underline the customers, your clients who have an HSA, FSA. This is known by them. So we found it doesn't require a ton of education if you just say HSA, FSA, that connects. But it's been a learning curve for a lot of us, including me. So let me just go really tactically into how that 30-40% works. So the funds themselves, it's mandatory by law tied into payroll systems. Again, 80% of the country has an FSA, HSA. If you elect to contribute money into that, it pulls out of your paycheck into a separate account every pay period, but it pulls the money before taxes are withheld. So, you get your paycheck and it's a lot less than your pay. This is money pulled the exact amount. It's pulled pre-income tax. So we've done some surveys, and average savings then is 30%. The average income tax rate of, and they have a calculator on this, but if you're in California making not even that much, we've done a bunch of averages, right? But income tax rates range from 20 to 50+%. So it's whatever their bracket is, that's what they're effectively saving. So the money in the HSA or FSA account is money that's been pulled pre-tax. So if they spend $400 a month, and they've maxed out that account, $10,000, they can then just use and reimburse themselves. It's a quick process, but they go in and just click one button. They're able to pay themselves back. So if they spend $400 with you a month, they can pay themselves $400 a month from this account. That's basically that tax advantage money just waiting for a qualified medical expense to go back into their account. So they're reimbursing the full amount, but that money's effectively, represents that tax advantage savings for them to reimburse themselves with. That's how most expenses are reimbursed with HSA FSA. So I hope that's, that's super in the weeds, but hope that's clear.
Yeah, to provide a little bit more there, Callie, is it fair to say that, let's use that $400 example. I'm your client, Callie, I'm paying you $400 a month. I have this $7,500 limit, in which I'm contributing.
Right.
I'm not only paying 30 to 40% on that $400. I can opt to pay the full $400. But what you're saying is that me as your client, I'm saving 30 to 40% because it's pre-income tax. So I'm paying 100%, but I'm saving 30 to 40.
That's right. And the thing I just underlines, that rings like anyone that has an HSA FSA account understands that this is like free money sitting. They have a free money kind of sitting there. So it's essentially, if they have that account, a lot of people are underutilizing that account right now. They don't know what to spend the money on, or the money's even expiring. So we found that makes sense for people that have HSA FSA. Also, I will say open enrollment is coming up. So the vast majority of your clients have access to one of these accounts. So it is something to flag going into Q4. In the next couple of months, you click through and you'll be able to potentially contribute. I never contributed. This past year, I maxed it out to 7,800 or so. And now we're purchasing fitness, food, supplements for our family. And a lot of people that hear about us are making that change. So it is something going into next year. People can choose to contribute, then they get that free money.
Awesome. So I think that covers, Josh, your question on limits. There are no limits. They have what they have. They choose how much they spend. That 30 to 40% isn't going toward the membership per se. It's just what they're saving in free money.
Yeah. You get the full amount.
Yeah. Awesome. To that point, guys, with open enrollment coming up, it could be just for timing's sake, it could be a really good idea to set up an in-person town hall or a Zoom town hall where you're educating your clients on the ability to use something like this, if you so choose to do so. Because I don't think a lot of clients actually know that this is a possibility.
Yeah, and we'll add some messaging ideas into the page, Carl, and I have some already. But yeah, I think there is some good opportunities to me, it's psychologically, people get very excited when they hear, oh my gosh, I could use that tax advantage money for fitness. And it almost like to us, like mentally, they get prepared for that spend for next year. So yeah.
Yep. Josh, just to reiterate, I just saw your next question, still not 100% clear. No, they don't have to be they don't have to be a TrueMed telehealth client. If they don't have a doctor that will give them that note, they do pay $30 a year, or you pay $30 a year through TrueMed for them to get that note.
Yeah, that link that you send them gets them that telehealth to get that note, and we charge $30 for that. That's our model. There's no client that's what we enable that with that note, and then we're being integrated with a lot of industry leading companies ideally from our standpoint, that customer, we're not remarketing them in any way, but they see TrueMed pop up in other places and are able to purchase their supplements, to purchase their protein powder, things like that. But no, they don't need to be any affiliation with us at all. That link that you give them gets them the note and helps them with the compliance.
Awesome. I'll keep rolling
Yeah.
questions. We had one from Lee. Is the note specific to your gym, or can a client take this note from you and go anywhere?
We are going to delineate, because you guys are a trusted provider, CoachRx, and make it a specific recommendation in the note. So it would be difficult to go too widely outside of your services.
Awesome. And then another question from Candace. That was my question. Why would the coach pay $30? But that's coming off of a more extended question up above. But I think if we hit that, it'll answer both of those.
Yeah. So there's two cases here. If you're talking to a client who's not a customer yet and they're price sensitive, this is able to offer them that telehealth, what we provide, in order to unlock savings for that customer when you still get the full amount. So our service, the point of our service, which we're seeing great results on, is that it's a tool to drive that sale. So it's the ability, what we offer is for you to hand free money to your customer in order to close that sale. So we have a lot of flows on other products, high touch items, expensive items, where in the sales process, if there's a concern or a perceived concern about price, the sales process involves asking if they have an HSA, FSA, and offering this to help close that sale. For your existing customers, why would you give this link to your existing customers? Because it's $30 a year for you. That unlocks then the fact that they're able to use tax-free money in perpetuity for the next year to pay for your services. So it's offering your existing customers a 30% savings to use on your services going forward, which has driven up retention. So what's in it for you is both closing that incremental sale and giving people essentially free money to pay for future. Candace, let me know if that makes sense.
Yeah, Candace, just to add to that,
yeah.
from a business standpoint, $30 is an extremely small price to pay. Let's say that you're bringing in a client that's paying you $350 per month times 12 months. That's $4,200. I think it's a nice gesture to handle that for the client, and it's a very, very small price to pay from a business standpoint.
And I would just say the data we're seeing consistently is driving high ROI. I mean, you hopefully will be able to see this on the incremental customer. If you're feeling some consternation around price, this has been shown as something to get them over the line. And then the retention metrics, you can watch, try to watch the cohorts of people that use us versus your normal churn rate. I mean, we would, if we're not driving clear ROI, like please reach out. We're seeing that consistently, and that's the whole goal of this company. And what we're seeing is that $30 really pays for itself because you're giving people free money, which reduces churn. It's free. Candace, you asked about it being free money. It's free money in that it's money that's sitting in an account only to be used for qualified medical expenses. It's money that they have that's not like coming out of their bank account going forward. It's money that's already there in that account that is very underutilized right now. So it's a pot of tax-free money that you can tap into.
Yeah, and to Callie's point, the use it or lose it thing with FSAs, HSAs, that becomes an issue for most people toward the end of the year, where they're scrambling to figure out where to use it. And the part that is actually free money, and forgive me for being extremely repetitive here, the part that is free money relative to spending out of just your normal checking account is that you're actually getting 30 to 40% of free money because it's pre-tax. Okay, so I know Callie mentioned California. California is probably getting upwards of 60-70%, but 30 to 40% is actually free money because it's pre-tax. Awesome. Yep, just let me know if you're good there, Josh. To your question, I'll give my 2 cents. I would definitely, I would, especially with your price points, just because I know where you're at, Josh. You paying $30 per year per client. You're paying maybe a quarter of 1% to cover that $30. So I would highly recommend covering that $30. I think it's a nice gesture. We had a question around let me find this. Okay. Michael, is there a denial rate for getting
Yeah,
that?
great question. Great question, Michael. So we're being very open about this and talking about this on podcasts. It kind of goes back to that American Heart Association stat. I think I mentioned at the beginning. But we, I think I'm speaking to choir here, but we have a metabolic health crisis in this country. 93% of people show biomarkers for metabolic dysfunction. So we're very outward, agreeing with the American Heart Association that everyone should be on a statin. We don't agree with that, but we agree that most people should be on an urgent prevention plan. So we, and according to the IRS, right, this works for people reversing. So that's 60% of people have a chronic condition or actively working to prevent a condition. So our survey asks both those questions. And to answer the question directly, 98% right now is what our approval rate is. And our disapproval, it's all at our clinical team's judgment. That's how the compliance works. But the reasons generally for disapproval is if they customer does not denote anything they're actively trying to reverse or prevent. But that's been 2%. Yeah, those are our stats.
Awesome. I don't see any new questions that have come in. We'll give a last call for any new questions if anything's unclear.
Yeah, I'll just say I see a couple questions about like email communication, things like that. We will try to just add as much information and messaging into our page on CoachRx. Carl, hopefully we can put a customer support email on there for us. We're happy to help with any one-off questions. And again, our goal here is to enable you, is that we can provide you that link and work with you to merchandise that in creative ways to drive incremental customers, to drive retention. We're your partners here on that. And obviously folding that into emails, the one-on-one communication, social media, we've seen a lot of success with all those levers. So we're here to support, but using that link as you see fit to drive those outcomes, that's what we're here to do and here to help with.
Awesome. Yep. And then Georgia just dropped that partner page again.
Great.
That's in CoachRx. We do have an option there, or you do have the ability to reach out directly to TrueMed via email, via that partner page. So that option, that contact TrueMed option is right in there. Yeah, let's wrap it up there. Callie, man, I really appreciate you jumping on. Super insightful. I'm going to dig a little bit more into some conversations that you've had around the country the past few months here. Really appreciate it.
Thank you, Carl. And thank you to everyone on the call.
Yep, definitely. All right. We'll see everyone. Thank you.